We've had a chat about why you developed the SRC products, but I wanted to ask you, what are the main conditions that the SRC Recovery shorts address?
The principal conditions are caesarean section, and as you know, approximately greater than a third of women now in Australia have a caesarean section. The other one is perineal tears and stitches. If you have a vaginal birth, especially if it's your first baby, you're more likely to have tears and then subsequent stitches. The other issue that the recovery shorts address is what we call separation of your abdominal muscles. It's called DRAM, which is diastasis of the rectus abdominis muscle. So because of the pregnancy, your abdominal muscles, your rectus abdominis tends to split, and that needs to come back together. So the recovery shorts address that.
And that's really common, isn't it? I mean, even really fit
common.
Women out there, you know, have that separation, and
Absolutely.
as much exercise as you can do doesn't always bring it back together. So it does just encourage those muscles, doesn't it?
It reminds them. It reminds them to. The level of compression is really gentle, but it's continuous. So it reminds them to remain active. So that's what brings them back together. But of course, you have to do exercise as well as using the recovery shorts. But in the first 6 weeks, which is the really vulnerable time, the recovery shorts will work on their own, so to speak, with very, very gentle exercise as prescribed by your physiotherapist.
Yes. So you have an ASP, which is an anatomical support panel in your products. Can you explain a little bit more about what that is?
Yeah, actually, the product has multiple anatomical support panels. So the abdominal panel works to address separation of the abdominal muscles. The gusset panel provides really nice support to a caesarean wound and any perineal wounds or stitches. I wanted to really address the anatomical areas specifically, so one piece of fabric was never going to be able to do that. So that's why we created the anatomical support panels.
So it's got little sections that sort of, you know, lift you up and hold you in and make you feel nice and comfortable.
Yeah, it provides a really lovely level of compression and support to that
in the right spots.
Targeted area.
Yes.
And because of how each panel is cut, that's why it works so well.
Wonderful. Thank you.
Pleasure.
So much.